we do this, think about stabilization. So stabilizing the pelvis, which is where the rectus femoris has its origin. With flexing the knees, stretch the rectus femoris more.
Yes.
No, are you tight? She's going into an anterior tilt. Oh, I can see it. Can you see it? Can you see it?
Is that the knee she's had the surgery on?
You've had surgery on both knees, haven't you?
Oh, okay.
Wow, we got some tightness there.
Well, there you go.
So, let me know if I'm hurting you. So, I can get kind of a stretch just keeping her from going into an anterior tilt. But for your standard person who's not quite that tight, all right, we're going to have to do hip extension also. All right, so now what do you think about holding this for 15 or 30 seconds?
That's what you do.
Not easy, right? Okay,
Especially if
so-
your patient's big,
Yeah.
larger than
Yes.
little Leslie
Right.
there.
So what did we do there? We could do side lying. I don't think this is in your book. Can you lie on this side, please? And we'll just switch legs.
There's a sideline.
And is there? Okay.
Mhm.
All right, go ahead and relax your leg in my hand. And relax. No, really, relax. All right. So but again, you have to stabilize the pelvis, right? And flex the knee. And let me know if I'm hurting you. We just want a pulling sensation. All right, holding for 15 to 30 seconds. All right, now, if she's really tight, what's another position that's a more mild type of stretch for that? Ooh, all right, the Thomas position. You get supine, get real close to the edge over here. All right, and we'll stretch this side. So bring this one into your chest on your way back. All right, very good. Okay, and why is she holding this in hip and knee flexion? To try to get her pelvis into posterior tilt. The more posterior it is, the more you accentuate the stretch on the hip flexors, which pull you into an anterior tilt. You could give some overpressure here. If I wanted to emphasize rectus femoris, what would I do? Flex the knee some more. Ooh. Okay. All right, so that's called the Thomas position. We use that for testing flexibility, but it's also a position you could use for stretching. And that would probably be for somebody who needs a more mild type of stretch.